Hello and welcome to Killing Cancer Kindly. Today we are debating a hotly controversial topic, which is male circumcision. This is taboo in many countries and cultures, but we will have an objective look at it and see what are the pros and cons of circumcision and what impact it has on male and female health. Most interestingly, we'll answer the question, does male circumcision reduce risk of female cancers? And if so, what is the mechanism? But before we do that, let's go back to the history of circumcision. The process of circumcision, which is excision of the foreskin from the penis, is thousands of years old. The oldest evidence we have is from ancient Egypt, where there are pictorial evidence of this procedure being performed. Although generally associated with the Judaic and Islamic faiths, it is a fact that circumcision is also an integral part to some ancient Christian churches. The Coptic Christians and the Eritrean and Ethiopian Orthodox Church also practice circumcision. Interestingly, circumcision is not just limited to religious communities. In ancient cultures such as the Aboriginal Australians and the Native Americans, including the Incas, Mayas, and Aztec, circumcision was performed. It is estimated that 4 out of 10 men globally are circumcised. There are two types of circumcision, one which are done on religious basis. These are usually done in early childhood. And the second is a medical circumcision. This is done due to diseases or abnormalities in the foreskin, where it becomes important to remove the foreskin to treat the disease. The World Health Organization has recommended circumcision for a very long time in areas where HIV and AIDS are endemic, because there is a very good evidence that by performing circumcision, the rates of HIV and AIDS infection can be effectively reduced, not only in the males but also the female partners who are at risk of exposure to this virus. And this takes us to the next level of our discussion: cancer prevention and circumcision. Male circumcision reduces risk of all kinds of sexually transmitted diseases, especially HIV, AIDS, and human papillomavirus. The latter, the human papillomavirus, is implicated in many cancers, especially penile cancer and cervical cancer in the females. Circumcision removes the foreskin, which can be a source of infection and also act as a reservoir for the viruses like human papillomavirus. So men who are circumcised are at less risk of contracting the HPV virus, less risk of suffering from it and developing penile cancer, and also at a lower risk of transmitting it to their female partner, which eventually reduces the risk of cancers like cervical cancer in females. Now let's come to the controversies surrounding circumcision. There are many communities and societies who frown upon this practice because they consider it a mutilation of the human body. And there are also concerns that the procedure is carried out on individuals who are too young to make their own decision. Having said that, for religious and cultural purposes, to preserve the identity of a community, circumcision is allowed in most countries all over the world. And the benefits of circumcision extend from preventing sexually transmitted diseases to prevention of cancer. And this benefit is not just limited to the person who undergoes circumcision, but is also extended to their sexual partners. Thank you very much for listening and being part of our mission to prevent, treat, and cure cancer. I look forward to seeing you again and would like to request you to like, share, comment, subscribe, and press the bell icon and ask all your friends and family to be part of this mission to prevent cancer.